So why is it important to take part in Take Back Day? One reason prescription drug abuse is soaring in the U.S. Joining us this morning, Dr. Michael Sprintz, Medical Director of Memorial Hermann Prevention and Recovery Center's Pain Recovery Program, also founder of the Sprintz Center for Pain and Dependency. Good morning to you.
Good morning.
This is a very real problem, and I think that people don't realize how serious it is and how common it's gotten these days. What is going on?
Well, what's happening now is that prescription drugs are much easier to get access to than, say, illicit drugs in the past. And it's become culturally usual for people to go to the doctor, I have a problem, I have a pain, and immediately take a pill. So the explosion of prescription drugs such as opioids and other medications that are dangerous and run the risk for addiction and overdose are all over the place now.
And so what we want to do is make sure that you have those medications when you really need them, but then dispose of them when you're finished to make sure that nobody else can get a hold of them or that you don't accidentally abuse them later yourself.
Exactly. That's one of the big problems, is that everyone keeps their medication thinking, oh, I may need it later, I may need it another time. But the fact is that medications are prescribed for a certain reason, and as soon as you're finished with those medications, disposing of them decreases the risk of children getting them, of family members pilfering or stealing those medications, and it also keeps you safe.
What about those expiration dates? How important is it to closely keep an eye on those? I don't think it could hurt you, could it? Would it just lose its effectiveness?
Yeah, the reason why they have expiration dates is because they can no longer guarantee the efficacy of the product after that date. So it's not that they become more dangerous, especially with opioids. If used inappropriately, they are dangerous. But the expiration dates mean that the medicines may not be as effective.
Let's talk about all the overdoses going on, because a lot of the times it's accidental. People don't realize what they're taking. They may mix medications and some ideas to help keep people safe who absolutely had no intentions to abuse their prescriptions.
Well, one of the first things to do in order to keep the medicine safe is to lock them up. They have a lot of different medication drug lockers that you can use in your home. Throwing away the medication or doing, I think the DEA's Take Back initiative is fantastic. It's a great way for people to take care of all those medications they have all bottled up in their medicine cabinets, in their closets, and wherever else they keep it, and they can get rid of it that way.
Another thing that we had talked about earlier is if you're going to throw it away, do it so in a way that nobody would want to dig through it. So either if you have a cat, stick it in their cat litter, stick it in coffee grounds, something where you take it out of the bottle and you sort of bury it a little bit so that somebody digging through the trash doesn't end up hurting themselves with it.
Absolutely. And also read the medication labels, because a lot of the pain medications such as the fentanyl patch and some other ones actually are approved to be disposed of either at a take-back initiative or even in those medications. Sometimes it is okay to flush them, but that's only in those rare situations, because it's a greater risk of a child getting something out of the trash than it is of some of the exposure.
Let's talk a little bit about your plan and how you help people. So the idea is to treat people as quickly as possible, right, if they feel like they are abusing a drug and can't get off of it. Absolutely.
A lot of times people don't necessarily start out taking medications going, oh, hey, I want to have a problem with medication, or I want to be an addict. A lot of times sometimes it develops over time. There are genetic factors that go along with it. But the most important thing to do is, as soon as they feel that they're losing control, that they have cravings, that they're having problems with work, with home, with family, and yet they still continue to use these medications, the earlier we get someone to start to recognize that there may be a problem, the sooner we can help them. And helping them actually really improves their life, the lives of their family, and the community at large.
All right, it's great information, Dr. Sprintz. Thanks for coming in today.
Thank you for having me.
Good to talk to you.